Welcome to the first edition of the Friends for Mental Health podcast. We've got two guests with us here today. We've got Tammy Rice from the West Island CLSC, and we've got Michael D. Oliveira from the mental health team, or the youth mental health team at the Lachine LaSalle CLSC. Do I have that correct?
LaSalle. DLL.
Perfect. Questions for both of you. What is your background in the field of mental health, and what is your position in the youth mental health team? Just so that we can sort of frame the conversation for you guys.
I am a social worker.
Okay.
I've been a social worker at the CLSC, now the CEUS de l'Ouest de l'Île, for 22 years. I've been with the Guichet Youth Mental Health for 5 years.
Okay. And Michael, how about yourself?
Yes, so I'm also a social worker. I've been now in the public system at the CLSC for about 10 years now. Maybe a bit less. I worked at many places inside the CLSC, at intake department, adult mental health, and now at the youth mental health in the last, I'd say, 4 years. And now coordinator of the team in the last, I'd say, about a year now.
Okay. Wow. So we got a lot of experience here. What are some of the services that the youth mental health team provides? Like, if you were just to give a short summary of some of the services, just for our population, it's families who have a loved one with a mental health issue. So it's usually parents who have a daughter or a son with a mental health issue. Often they don't know even what are the services provided in their community, let alone the CLSC. So what are some of the services you guys provide at the CLSC?
Okay, well, it's majorly support. I'd say it falls into two categories, support and psychotherapy.
Okay.
Because we have psychologists, we have psychoeducators, social workers, but in the end, it's really us that's going to, with the client, see a bit what their needs are, and we're going to help the client find the appropriate care that they need. So I'd say we have kind of a reverse approach. It's not really up to the client to think, okay, what exactly is the services that I need?
Yeah.
That's our job.
Yeah.
So if the people feel like they need help regarding mental health, well, come to us, and then we're going to discuss with you a bit what could be done and see what's the best services. But most of the time, I'd say, as I said, it falls into the category of like support, general support, or psychotherapy for all kinds of different mental health issues.
Okay. Do individuals have to have a diagnosis before they go to the CLSC? I get this question a lot. Okay. Does my daughter or son need to have a diagnosis of depression or schizophrenia or borderline before going to the CLSC, or is that something they can get at the CLSC?
I can answer that they do not have to have a diagnosis.
Okay.
So they can call us, and like Michelle was saying, that we will help them step by step, and we will help them figure out the system, which can sometimes be daunting.
Of course.
A little overwhelming. So.
Absolutely. Especially on the outside, I think family members sometimes feel like it's daunting, it's overwhelming. They don't know where to start. They don't know what what's the first door to open to get their loved one help.
Right.
So what do you guys see as some of the challenges or barriers for young people getting services? First thing I thought of was stigma. I mean, we do a lot of in-school presentations, and a lot of kids, it's just stigma. They just don't want to talk about it. Wait times, obviously something that's present all over the province, all over the country. It's a challenge. Finances. But what do you guys see as some of the barriers? I would imagine stigma is a big issue.
Yeah, I would say the biggest barrier maybe for young people to get services is the stigma related to it, and also the fact that there's a lot of myths around mental health. Mental health is not a known issue. People are starting a bit more to talk about it, but still there's a lot of myths and things that are not really true about mental health that are circulating. Sometimes the different kids that come to us, they wait too much, or they come too fast, and it's other services that could be best suited. And also with youth, another thing is that youth are very dependent on the world around them. So they're going to depend on their parents, they're going to depend on school, on youth protection workers, and all those different things. So it's very hard for a kid, because of developmental stages and because of the way kids are, to come by themselves to ask for help. Yeah. So if the environment of the kid is not there to ask for help for the kid, that's another barrier, because of that's how kids are. They're not gonna come knock on my door to say, look, I need help.
Yeah.
No, we have a hard time to like get them out of the house. They're always on their Nintendo, PlayStation, or anything.
Yeah.
So if parents have a hard time connecting with their kids, imagine an outside person of that family connecting with the kid.
Absolutely.
So for youth and kids, it's very important that the whole environment is also participate in that care and participate in that access to care. Because as you said, there's many barriers. Some of them we don't have any control.
Absolutely. Yeah.
So that's it. We really need like the environment to be part of that support.
I think you just answered my second question, which was going to be, what role do you see families having in helping their loved one, and how can they best support their loved one receiving services? Because it's a question that I hear a lot from family members. Their son or daughter is receiving services at the CLSC. They want to know, okay, well, how can I help them? Should I ask about their session? Should I ask about their friends? Should I ask about school? Should I talk directly about the illness or not? Is there anything you guys any advice or any information you could impart on family members if they feel like they're on the outside and they just want to know, okay, how best to communicate with my loved one or ask questions about what's going on?
Well, I think, the key is communication. And when I will speak to parents who are supportive, even though they might be scared or they do not know what to expect, I've had, just to be able to keep that communication open, try to be non-judgmental, as difficult as that might be.
Absolutely. That's a good point. Yeah.
And to let them know, to actually say the words, we support you. We are here for you. We will, we can bring you to your appointments. We can make a call for you if it's difficult. We can sit with you. So those are a couple of things that I have found when parents do that it's really helpful.
Do you find with youth and young people that the idea or feeling judged is a huge part of the barrier to accessing services? Feeling either judged by parents or family members or being judged by those around them for having an illness? Like that's part of it. That's
part of it. I think also feeling very, like you were saying, very judged, but also that creates a lot of isolation. And especially now with social media and, where our youth are not necessarily together physically, where, it creates a lot of isolation.
Absolutely. And I'll tell you a bit of a story that I heard from one of the kids that I was seeing that was years ago. He had, because we deal mostly with the Douglas Hospital. Okay. And he had appointments over there. And he says, oh, Michelle, do you know how I know who are the other clients of the Douglas when I'm in the bus? I'm like, no, how? He says, we're all the kids that are getting off the bus a station further, because if we go out of the bus at the station of the Douglas Hospital, everybody in the bus is going to know that we're going to get services. Okay. But if you go at the next station, then all the people that are coming out of the bus and walking towards the hospital, then at least okay, they're getting services too, but we're kind of in between ourselves, so that's okay. So I was really surprised to see the length that people go to hide the fact that I'm getting services, I'm getting some help, because it's shameful, because of stigma and everything that's related to that.
The attention to detail that has to be paid to those little things, just a bus stop or, the way that kids would look at a mental health issue and how their friends would judge them, the lengths that they'll go for that not to be known. Sorry.
I just wanted to add one thing that because we have our team is situated on St. Charles, so oftentimes we'll hear that the youth do not want to come to meet with the professionals because they are afraid they're going to see somebody who they know.
Absolutely. And what is a way that you get around that? Is it the conversation that you have during the first session, or is it something that sort of happens more at a grassroots level?
Well, sometimes it occurs when we're speaking to them at the guichet level. Okay. And we will let them know that they will get an appointment time. And, it doesn't happen very often, but, it usually works out. If for some reason they see someone they know, they usually probably won't speak to one another. But I think it works that they'll see that they're not alone. Because that's, I think, a really important message to give them is that they're not alone. So if they do see someone they know, they probably won't talk to that person, but that they'll know they're not alone.
Okay. So the next question I have is something more on the level of a clinical type question. Something we hear a lot from family members is they feel like, especially with young people and youth, that there's an increase in rise of certain mental health issues. And so they feel that, I hear a lot, anxiety and depression is on the rise among young people. It's a difficult question to ask. There are probably lots of factors at play. I don't think anyone has an answer as to why that may be the case. Is that something you guys see at the CLSE in the West Island? Is that something that you're trying to put more energy into, or is it something that it's just maybe just in the public consciousness in a way that...
No, there is an increase of requests for services for sure.
Mm-hmm.
Now, is it because people are more aware of those issues and people a bit more, there's an expression in English, trigger happy to come to get some services?
Okay. Yeah.
Maybe. But it could be also an increase in just the way that our kids are stressed today, because the world that they live in is not the world that I lived in and not the world that my parents lived in. So it's completely different. Access to information is crazy. Mm-hmm. So it's a stressful world for them more and more and more. And I think there's less, I'd say and my hypothesis a bit on that is that usually families, I think, were a bit bigger and a bit more tightly knit together. And now we can see more and more a family that are a bit disengaged, a lot of parents that are divorced and things like that. Mm. And for youth, family is really the base of everything. So if that base is not too solid, then of course mental health issues are going to pop up. So is it because families are a bit less strong than in the past? Maybe. But then again, as you say, it's such a complex system of values and all different things that go in and that have an impact on our kids, that it's really hard to pinpoint one thing. But the world they live in is really not the same as the one as my generation or the generations before. Yeah. So that's it. I think it's just part of who they are, and we have a bit to accept them like that and be able to give services and react to those events, because the world is changing and so are they.
Absolutely.
I just have one comment to add that I find very interesting that we're hearing more about is the possible link to social media.
Absolutely, that's
and
something we
the
hear.
Increase of our of youth having access to phones and and we've heard that even from a lot of the parents that I've spoken to. Is the time spent in isolation. On their smartphones. So that could be a possibility as well.
Absolutely. Not socializing in any traditional sense, clubs, sports, activities. And
they're socializing a lot less.
Yeah.
And that could be a factor that some people have mentioned who I've spoken to, which is interesting.
Yeah, it's definitely interesting. And it's tough to say, too, whether that's a cause or effect, right? Whether the increase in social media is certain breakdowns in certain clubs and groups and sports and activities, and this is the result, or whether it's the other way around. It's difficult to say, but it's just something we hear a lot with family members. Yep. Another question that I get a lot that I think would be interesting is from the point of view of confidentiality, especially from a clinical perspective. Given the importance of confidentiality in the patient-client relationship, a common frustration amongst family members is not having access to the treatment team, especially when they feel they have relevant information that could help the team. How would you recommend families navigate this really delicate, really challenging issue of we feel like, we see them at home, we see the symptoms, we see the struggles, but we can't necessarily give all that information to the treatment team. Any suggestions, anything that you think would be helpful for family members?
It's a really interesting topic because as social workers or any other health professional, in Quebec, we're a bit bound by law. So if a client is 14 years old and over, he has a right to confidentiality on his medical file. So that means that even if a parent calls me to say, are you seeing my kid? If he's 14, I have to say, sorry, I cannot answer that question. Every time I've done it, I imagine myself as a parent receiving that answer, and I will go crazy a bit.
Absolutely.
Because it's harsh. It kind of creates a break. And people have to understand also that all the clinical approaches that we use in the health relation field, we always try to integrate family as much as possible. So it's not really the clinician choice to kind of put the parents aside or put everybody's aside. It's really the law that is made that way. Now, the law is there for a certain context also, because that way a kid, even if the parents disagreed with him having treatment, he can come and having treatment by himself.
Exactly.
So it's kind of responsibilize him a bit. So he's treated as an adult as 14, but they're not adults as 14. Far from that. So it's really hard. What I would say to parents is that even though we cannot tell them that, look, I'm seeing your kids, it's happening this. The law forbids us from that. But the law doesn't forbid us to hear what you have to say.
Okay.
So if you want to, that's what I say. I cannot tell you anything about your kid, but if you want to tell me anything about your kid, go ahead.
Mm-hmm.
I don't have confidentiality. It doesn't work that way. Tell me everything you have, and if it's usable for me, I'm going to use it. If not, it's not.
And are you then bound to tell that child that the parent has contacted them? I've had that question before, and I know that's a delicate answer.
Exactly. No, because the parent also has a right to his confidentiality, but that could be negotiated between party. If I could say to the parent, can I tell your kid that you called me to say that?
Absolutely.
If the parent says yes, then I can. If the parent says no, then I can't. So really, the people transmitting the information is really controlling who get access to that, and not us. So parents could use that. They could say to us, yes, tell my kid, or no, but I just want you to know this week he hasn't gone out of his room all week, and things like that. Now, we won't say it to the kid, but it's going to be in her head when we're intervening with the kid. So we can use that information. So there's never too much information. Parents can always call, and we're going to receive that information anyway.
It's good to know, because that's a question that we hear often. Should we contact the treatment team? Should we contact the social worker or the psychologist? And often what I say is, more information the better. It helps you guys work with the child. If you know that this symptom is more prevalent or this medication's not working, it guides how how you're going to, like you said, how you're going to intervene with them. Sorry, I think I cut you off. You were going to.
No, I just wanted to add that I think in the instances where the parents have open communication with their child, which is not always the case, but in the instances where they do, that I will always encourage them to let them know, because they care about them, that they want to contact, the reason why they want to contact the professional. And so to keep that, just to have their child understand their motive. Is that because they care and they want to help?
Absolutely. That's perfect. I've got 2 more questions for you guys. What would you say to family members who feel that their loved one is hesitant or reluctant to call the CLSC to get services, and or how can they facilitate that conversation? Because I know that's a challenge, again, with a 14-year-old or 15, 16, 17-year-old. A parent may know that there absolutely is a mental health issue present. They don't necessarily know how to get that conversation started, and they don't necessarily know if the child is going to, be open to it, and they may overtly be reluctant. Is there any advice or any information you can impart on family members?
I find what's helpful, what I have seen, because we do receive referrals from our general intake, so they have appointments, and I find in the cases where the parents accompany the child, let's say the adolescent over 14, who is open, sometimes that takes away some of the fear. Where am I going? Who am I going to speak to? The parents who are able to support them. I find that works very, very well. In the instance where the adolescent does not want the parent to come, that's trickier. But in the best case scenario, if the parents can accompany them, that's an example. I find it works very well at our intake.
Yeah. What I could say also to parents is that if they have a child at home or a kid or youth that's having mental health problem who doesn't want to get treatment, it's very hard on the parent because it's a lot of responsibility. So I always say to them, share that responsibility. Speak with other people in your family. Speak with your friends. There is parents helpline that they can call. They can call us at the CLSC to really share that responsibility to everybody, to almost everyone around that they can share it with, because that way they're not alone in this anymore. Because the worst for a parent is to feel like they're alone because they're cut from their kid because of mental health issues. So the family's getting smaller and smaller, and they're alone with their problem. They have nobody to talk to. It gets worse. It could create even mental health problems for parents then. And that's not a solution. It won't go well in the end. So share that responsibility. Talk about that with others in your environment. And people are going to be surprised how mental health problems are like across the board everywhere.
Absolutely.
And they're going to encounter somebody in their environment that's going to be like, well, I had that problem with my kid too, or my kid too had that problem. Okay, how did you deal with that? I did this. And then it creates an exchange. And then it's kind of a helping relation that's going to have them like be a bit stronger in that issue.
I feel like that was a perfect plug for Friends for Mental Health. Parents can contact us as well.
Exactly.
But It's something that we emphasize all the time too, and it's really important. It's a great point. I mean, you can't just sit with the illness. You have to reach out. Parents need the support just in the same way that the kids need the support as well. I mean, we know outcomes are best when everyone's involved, and sort of that's the goal. Last question. If one of our, someone that calls us is wanting to get services for their daughter or son, how do they reach out to the CLSC? Who do they contact? What are the steps? Just, quick, brief little snapshot of what the best way to go about doing that is.
The best way to go about doing that would be to call their local CLSC and ask to speak to an intake social worker. So they can speak to an intake social worker over the phone, or they can schedule an appointment to meet with the intake social worker.
Okay.
Either first on their own or with their child. That's usually how it works.
Yeah, exactly. There's a couple of other doors that could be open also. They could always speak to their family doctors, or that's if they're, people that are followed by the youth protection, they could ask their youth protection worker. They could inquire at school. Those are all different doors that could be used by the parent. But the more direct way, where they're going to speak right away with a social worker that's going to be able to give support, is really just to call the CLSC, say that you want to speak with a social worker at the intake, and that's it. They'll communicate you to somebody who could answer your question and then refer you elsewhere if needed, or in the CLSC if services is needed.
And so the parent can make that phone call for the child, or does the child have to make that phone call?
If the child is over, parents can always make that phone call for the kid, but ultimately, if the kid is over 14 years old, we're going to have to get his consent for services.
Absolutely.
But they can do that phone call with the kid just beside them. I've had a lot of that where, my kid is a bit too shy. I'm calling for him. Okay, where's the kid? Oh, he's just standing beside me. Okay, well, start talking to me. And after a bit, the kid is like, well, Mom, no, I'm not. It's not like that. Okay, let me speak to them. Yeah. And then we're able to get contact with the kid. So really, I think the way that we have to know is that there's no wrong way of doing that. Just get in contact with us. And if there's an issue regarding, I'm calling for somebody else or anything, we're going to help you navigate that. Because it's already complicated for parents today. I mean, the less problems they can have, everybody's going to be happy. So just contact us and we'll guide you through the process the best we can.
I just wanted to add also that there is the 811 service that a parent can call that I believe is open until midnight, that they can speak to a nurse, they can speak to a social worker. So that's another avenue as well when the CLSC closes.
Okay. A lot of different opportunities, a lot of different ways parents can get their children's services. Well, thank you, Tammy and Michael. I appreciate your time. This is the first edition of the Friends for Mental Health podcast. We are done.